Healy & Weber has taken the range of motion hinge knee to a whole new level. Can I show you what we've done? Years ago, when John Healy was approached by Dr. Tom Knapp to build an anterior closed knee sleeve to help his patients who had a difficult time pulling up the old sleeves, what emanated from that project was the first anterior closed hinge knee orthosis introduced to market. It is possibly the most copied product that John Healy has ever built. While most have chosen the path of low cost, which compromises the effectiveness of the brace, Healy & Weber has improved the Knapp family of braces again and again, and now we are so excited about the new Knapp 2 range of motion family of anterior closed knee orthoses. The Knapp 2 includes all the great features of the original Knapp brace, with the multiple reinforcing stitches, the zigzag stitches and the reinforced zigzag stitches around the hinge pockets and sewing up all the binding of the brace, a single straight stitch that outlines the entire pocket to triple reinforce those hinge pockets, bar tack stitches throughout the brace in all key potential wear areas to prevent failure. To the medial and the lateral Mauser seams, we've added a heat-bonded tape called Melco taping that not only reinforces the stitch, but puts an incredibly smooth finish in a really sensitive area of the patient, right at the popliteal area. And as with all Healy Weber braces, we cut the stitches short and add a dab of silicone glue to all the stitch ends to prevent them from fraying out and providing good stitch stability. And when we close the brace up, just like with our other Knapp braces, instead of a little thin strip of loop to close the brace onto, we provide double and triple the loop so that the brace can adjust within size, but also to the size of the patient as they expand and contract throughout the day. And with all of our calf and thigh straps, we've added a piece of very, very strong elastics that allow the brace to actually move with the patient, preventing the brace from slipping, as well as preventing cramping from occurring in the major muscles around the knee. And those elasticated straps wrap right through a D-ring that's been ultrasonically welded so that it can't turn sideways, allowing the straps to pull through and always lay flat on the patient's leg. And to all that, we provide excellent support by using an easily adjustable hinge. After testing all the hinges in the market, we set a strength standard to build our new patent-pending pop-stop hinge to be the best in class. The arms on the pop-stop hinge are made of T6 hardened aluminum, yet are still bendable to accommodate varus valgus deformity. So upon fitting, they can be bent to the patient's anatomy. Now, I've removed this hinge from the brace to show you one incredible feature that the new Knapp 2 provides. The pop-stop hinge has been designed to minimize the hassle in changing range of motion settings. To adjust the range of motion setting, simply take the tool that's provided and pop off the slide guard from the hinge. Bend the hinge, insert the tine, and pull the 10-degree extension stop out and replace it with a 20-degree extension stop if so desired. If zero flexion is desired in the hinge, simply pop out the anterior stop and insert into the posterior area a 0 degree of flexion stop. And when we do that, the slide guard, which has a lip that normally rests on the top of the brace, we flip that slide guard down to the underside of the brace and lock the cap in position. And now the brace itself cannot move. If the 0 degree flexion stop needs to be removed, we simply pop off the slide cap, remove the 0 degree flexion stop. We can then reinsert the 10 degree of extension stop into the brace and return the slide cap on, and the hinge is restored to its factory settings. A basic set of stops are included with every brace, but for a complete set of stops, we make available at no charge this professional kit for a complete range of motion settings at 10-degree increments. To apply the brace, note that the hinges have been pulled back a little posterior so they pull mid-joint upon application. This helps reduce the splaying of the hinges when the patient's in full flexion. All we have to do, because it's a wraparound brace, slide it onto the leg, secure the calf first, and then secure the calf strap To secure the calf strap, we want to give it a little bit of a pull, anchor it to the Velcro, and then cinch it down. You'll note when we actually grab the top of that calf, the brace will not slide down the leg. It maintains its position incredibly well, so we don't have to worry about distal slippage. Then we complete the application by wrapping at the thigh and securing that strap in the exact same manner where we give it a little bit of a pull, hook it onto the Velcro on the side, and then complete the wrap for a finished application. You have a low profile, cool, compressive, and comfortable orthosis made from the best materials with a new standard. They simply don't stretch out. Can you see how we've taken the range of motion brace to the next level?